Symptoms not to ignore. Source: Reader's Digest. By visualgk.com. White ring around your cornea. Don't worry. If you've noticed a ghostly pale ring around your cornea, the clear layer of protective tissue that covers your iris and pupil, it may just be a normal part of aging. As we get older, the edge between the cornea and the white of the eye becomes more porous, allowing fatty deposits from the bloodstream to leak in. Arcus senilis, as it's called, doesn't impair vision or require treatment. Do worry. If you're under 40, the white ring might be your first sign of high cholesterol, so better have your doctor run a blood lipid profile, which measures levels of cholesterol, triglycerides and other fats. Red spot in your eye. Don't worry. A broken blood vessel, called a subconjunctival hemorrhage, can happen from coughing, sneezing, or even straining too hard on the porcelain throne. Also, taking medications such as blood thinners can predispose you to it. Blood can then pool under the clear protective layer, sitting over the white of your eye, and even spread all the way around. It usually resolves on its own after about 2 weeks. Do worry. If it occurs on a regular basis, or if you're having spontaneous bruising elsewhere, it could be a sign of something more serious, like a clotting disorder, or diabetes. Constant headaches. Don't worry. A headache is chronic if it occurs more than 15 days a month, for a minimum of 3 months. Common triggers are dehydration, sleep deprivation, vision problems, sinus congestion, poor posture while working at a desk, and hangovers, all of which have straightforward solutions. Do worry. If you've ruled out all of the above, it's worth a call to your doctor for more investigation. Ultimately, you may not discover the cause. This is true for many people who suffer from headaches, but medication, dietary changes and certain supplements can help. Hair falling out. Don't worry. Each day, the average person loses 50 to 100 hairs from their scalp. But when you suddenly notice clumps in the shower drain, it's considered abnormal, and could have a number of mostly benign causes, including illness, surgery, stress, a high fever, a crash diet, or hormonal shifts like childbirth and menopause. It can take 4 to 7 months to begin regaining your normal hair density. Do worry. Hypothyroidism, or an underactive thyroid gland, can cause hair to become brittle and thin, as the disease slows your metabolism, interrupting your hair's growth cycle. If left untreated, hypothyroidism can cause complications like heart disease. Ringing in your ears. Don't worry. Tinnitus is surprisingly common, and most often lasts a few minutes, hours, or days, but sometimes it lasts forever. The most common cause is hearing loss, whether temporary, from a loud noise, for example, or permanent, as with aging. Although it's not a medical emergency, tinnitus can affect quality of life in the long term. Have your doctor look inside your ears, as tinnitus can sometimes be caused by an obstruction, like wax buildup. Do worry. If the noise is rhythmic or pulsing, see your doctor right away. That can be a sign of narrowing in the carotid artery, near your temple, which puts you at risk for stroke. White stuff on your tongue. Don't worry. A white coating on your tongue is most likely a sign of poor oral hygiene. It's actually a mixture of bacteria, food debris, and dead skin cells, trapped between the little bumps on the tongue. The simple solution is to brush your tongue daily, or use a tongue scraper. Also, an overgrowth of yeast, called candidiasis or thrush, can happen when antibiotics, chemotherapy, or diabetes kill off the healthy bacteria in the mouth. It can be treated with antifungal medication. Do worry. Leukoplakia, characterized by thick white patches that can't be scraped off, might be an early sign of oral cancer. See your dentist if any unusual spot sticks around for weeks. Lump near your neck. Don't worry. Lymph nodes are bean-shaped glands that play an important role in your immune system. When bacteria, viruses, or other foreign substances invade your body, your lymph nodes can feel swollen and hard, with all the white blood cells piling in to fight off the assault. Once you're done battling whatever it was, they will go back to normal. Don't worry. If you feel the lump in the hollow above either collarbone, these can be important sentinels for disease in your abdomen. If it happens on your left side specifically, it's called Troisius sign, and it's considered an indication of cancer in the stomach or other organs. Hands. Don't worry. Genetics can be the reason your hands always feel like icicles, even in summer. Research shows it runs in families. The elderly, who tend to have slower circulation, as well as very thin people without much insulation, can also feel more sensitive to cold. The solution? Avoid nicotine and caffeine, which restrict blood vessels and dressing layers, to keep your core temperature up. Don't worry. Raynaud's phenomenon is a vascular abnormality characterized by attacks of cold, pain, tingling or burning, and white or bluish color in the fingers. It can be managed with medication, but in some cases, Raynaud's can be a sign of an autoimmune disease called scleroderma. Anemia can also make your hands and feet feel cold. Chronic bloating. Don't worry. Nearly 40% of the population struggles with gas and bloating. It's important to note, though, that it's normal for bellies to change shape over the course of the day, and passing gas up to 20 times daily is just part of the way your digestive system efficiently turns food into fuel. Don't worry. If your bloating never goes away, or is accompanied by other symptoms, such as severe cramps, changes in bowel habits, blood in your stool, nausea, decreased appetite, or unintentional weight loss, see your doctor. Diagnosing irritable bowel syndrome, celiac disease, ulcerative colitis, and colon cancer can require a more thorough workup. Joint popping or clicking. Don't worry. That snap, crackle or pop you hear when you stand up, walk downstairs, or stretch, is called crepitus, and it doesn't necessarily mean you're decrepit. It's either caused by gas bubbles forming in the fluid that surrounds and lubricates the joints, or the sound of a tightly strung tendon, snapping as it slides over a bony surface. If the noise is painless, it's nothing to worry about, and it becomes more common as we age, especially in the knees. Don't worry. If the cracking hurts, or the noise changes to a crunching sound, see your doctor. As arthritis progresses, the breakdown of cartilage can lead to bones grinding against one another. Enlarged big toe. Don't worry. You may not think about your big toe much, but when something goes wrong with it, you'll wince with every step. Ingrown toenails are a common cause. A mild case can be treated by soaking the toe and applying antibiotic cream. Don't worry. A lesser-known form of osteoarthritis affects 2.5% of people over 50, and causes inflammation, swelling and aching, in the joint connecting big toe to your foot. Over time, the bone overgrowth caused by the condition can make it almost impossible to bend your big toe, and lead to protruding bone spares. The symptoms can be managed with medications, custom-made orthotic insoles, physiotherapy, specialized shoes, or even joint replacement surgery. Please like, share and subscribe. visualgk.com